Good evening, everybody. Sorry to keep you slightly waiting there. I'm Michael Johnson-Ellis, co-founder of My Surrogacy Journey. And this evening, or this afternoon, wherever you're watching from, we're going to be talking about Canada. And as you can see from my screen, I'm joined by 3 other professionals and individuals that work in this space. So I'm joined by Michelle Avery from JA Consulting. I'm joined by Natalie Sutherland, a UK lawyer from Burgess Mee, and I'm joined by the infamous Dr. Rahi Victory. How are you all, firstly?
Very well, thank you.
Good.
Wonderful, wonderful. So what I'm going to do first is we'll do some more intros in a second. And just for the benefit of everyone watching today, we are going to be talking about third-party reproduction. We are going to be talking about parental order process, and we're going to be covering off costs of a surrogacy journey as well. Some few contents and housekeeping on the screen now with introductions with regards to who we all are, and then we'll give you some information about us as My Surrogacy Journey. Firstly, apologies for the formatting on StreamYard. The title, my OCD goes crazy on StreamYard because I hate the fact that the font is not right. It's driving me insane. This frustrates me. But in terms of, let me make that screen bigger. We are going to be talking about this particular topic and how we support people on an international journey. So My Surrogacy Journey was first formed in February 2021, and we support people in the UK and in the US. And certainly our international pathway unfortunately took a slight backseat for the last sort of 6 to 9 months whilst we were just stabilizing our UK operation. But what we are seeing now is more of an appetite and a desire for UK and some European intended parents want to come back and get full support on a US or a Canadian journey. And more recently, more and more people talking to us about Canada, and whether that's a fallout from a lot of Europeans using that Ukraine destination and that certain cost point are moving away. We're definitely seeing more people inquire at first and ask about Canada first. And we're going to touch on that in a little while. We're a privately funded organisation, and we support people all the way through into parenthood and beyond. And we're an inclusive organisation that supports everyone on that journey. Me and my husband are founders. Quick rogues gallery of us and our 2 children who look tiny in this picture. They are a little bit bigger than this now, but we founded the organisation after our own surrogacy journey that we had in 2015 and 2019. As I've said, I'm joined by 3 individuals today, and if you are not new to Canadian surrogacy, these faces are going to be quite well known to you, but if you are new, then welcome. This is going to be something that you're going to enjoy. I know I'm always fixated by the cars behind Dr. Victory. I know that it always fascinates me. I always want to get in really close and just see if I can name all of them.
I can name them all, yeah.
I'm sure you can. I'm sure you can. Let's start with you, Doctor. Give us a bit of a background to you, your operation, what you do.
Sure. I am a Canadian-trained OBGYN. When I finished my training in Canada, I went to the United States for 3 additional years to become a fertility specialist, and eventually led to opening up my own clinic. And here we have a full-service reproductive endocrinology infertility facility, where we are currently amongst the largest of Canada's third-party service providers. So when people need egg donors or they need surrogates, many of the European clinics are actually coming through us to facilitate that journey for them. Our program tends to be very hands-on. We focus a lot on communication. I am hell-bent on providing exceptional levels of success. So we focus a lot on education and on promoting kind of healthy behaviors and getting the best possible outcomes for our patients that we can.
Incredible, incredible. And we're going to come back to more little insights and questions to your work and what you're seeing at the moment. Michelle, over to you. Give us an intro to yourself and everything that you do.
Hi, so I'm Michelle. I'm the COO of JA Surrogacy Canada. I have been in this position for almost 3 years now, and JA has been in operation we're coming into our 4th year. I'm just going to throw this little tidbit of information out there. On my team call the other day, we realized that we're celebrating 100 surrogate babies being born. So we're so thrilled that we've reached such an amazing milestone in less than 4 years. So our agency works with clients globally, all over the world. We focus our surrogacy finds through Western Canada. Right now, we are very prevalent in Western Canada, but we're building our base through the rest of Canada. Our agency headquarters is located in Alberta, but I am located here in Ontario. And we work with every possible clinic that we possibly can. We have a good relationship with every clinic in Canada and a large majority of them in the States. Dr. Victory has been paramount in assisting us with some things, with some of our clinical things with the States when we were dealing with COVID. So thank you, Dr. Victory. We do quite enjoy our relationship with you and Mara. So we have a team of 15 people right now that focus on client relations. And we have a huge focus on surrogate support as well as intended parent support. And it's one of the things that sets JA apart in the Canadian surrogacy industry is the individualized surrogacy support and intended parent support that we offer all of our clients.
Super. I'm going to come back to talking about support in a minute. So thank you, Michelle. And last but not least, Natalie Sutherland from the UK.
Hi. Yeah, so I'm Natalie. I'm a partner at Burgess Mee Family Law. We're a boutique practice with 3 offices in London, and I deal with all aspects of family law, but particularly surrogacy and fertility law. So if you are a UK domiciled intended parents but looking to do a Canadian journey, then when you come back here, you'll need a parental order, and that's where I come in and help.
Super. I'm going to come back to all of that fun stuff in a minute. Thank you. Bit about our team. We're now a team of 19 and an advisory board team of 23 now. We work from a Canadian law point of view. We engage quite heavily with Rachel West, which I'm sure you're all familiar with as well. She's currently on her vacation in Europe. But she sends her regards. So I've already covered off this particular slide, and Michelle, we're going to come back to you now. So I've got some specific questions first. You've gone through some of the agent history and the country coverage with the expansion that I'm sensing is definitely underway. And congratulations on the milestone. Let's talk about that all-important question that intended parents ask us first when they're scoping out countries. Often when people land at our doorstep, they don't know what they don't know. So it's often there's no more Ukraine. Do they still want to go to Georgia? Do they want to head to Cyprus? Do they want to come to Canada? The US tends not to be on the radar when comparing all of them because of a budget point of view. But those are the countries that we tend to get hit with first. And we only have a Canadian route. We don't support those other countries. So that means that time and time frames is often the first thing that people want to talk about and hear. Can you share with us what the current time frames look like at the moment in Canada? Because I hear all sorts of numbers.
Right. And I think that I can speak to where we are at with our estimated timeframes. When a client comes through to us and they're prepared to start their journey, we are estimating 15 to 18 months before they'll move far enough up the list to be introduced to a surrogate candidate that meets their needs. And that's a guess. It's always a guess. With surrogacy in Canada being altruistic and not having a compensated model, we are often looking around for the greatest candidates we can possibly find to match those people up. But if you're, like I said earlier, if you're on number 165 or 175 on the list and your parameters match, what another candidate coming in looking for a surrogacy journey is also looking for, you could be matched in a couple of days, you could be matched in a couple of weeks. But the reality is it is a long wait. It can be a long wait, and we are currently estimating up to 18 months.
Mm-hmm. And in terms of then what that process looks like there on in, so when they are ready and have moved up the list significantly, what does that process look like for intended parents? What can they expect from JA?
Sure. So as you're starting your journey with JA. When you come to us, you generally already have your clinic and you generally already have your legal representation. But if you don't, we'll make some suggestions. We'll try to match you up with, give suggestions on a clinic. Like if Dr. Victory offers what this client is potentially looking for, then we'll send them that way. But during their entire time with JA, they receive one-on-one support, even when they're not matched. We are, from the start, we're reviewing their profiles. We're trying to tweak their profiles, make them a little bit more intriguing, a little bit more open, making suggestions for videos. We're building social media, what we call our intended parent snapshots, that we send out in email form to another set of contacts that we have for candidates that might not be ready to sign up yet, but maybe they'll see your profile and maybe they'll want to work with you. So we're constantly working from the day that our clients sign up to the day that they're chosen off of our list. To get them chosen, we're all working very hard to reach those goals. So they will hear from their designated support person at least once every 3-ish weeks, even if it's just an update on general life, but then to maintain that connection, that human connection, and building a rapport with the client. So when the client does get chosen off the list, that we have a great rapport with them and they understand what the process is. As the wait list moves, like any other wait list, the further up the list you get, the more frequently your profile is going to go out to incoming candidates.
Yeah.
So if you're number 10 on the list, it's highly likely that your profile may have gone out multiple times to different candidates coming in the door. So it's moving up the list gives you more exposure, but we are constantly trying to give all of our clients consistent exposure in the social media world as well.
Mm-hmm. And you often hear, certainly in the US, there's these particular premium packages that people can buy to be fast-tracked or premium. Is that something that exists in Canada, or is that something that JA do? It's something that we hear a ton that happens elsewhere.
We don't offer that. We have been asked, we have been offered, but it's not something that we don't have an exclusive list. We don't have we don't have a buy your way to the top of the list. All of our clients are treated as equally as we possibly can treat them.
Yeah, good. Nice to know. What I guess on that thread, things to look for, challenges then as IPs when they approach their agency. What, as an agency in the UK, when we're matching UK IPs, very quickly how this is going to go. So talk to me about, those red flags that you see at the beginning of a journey from an IP.
Sure. Yeah, for sure. And I think it's also, if we're to touch on red flags, we actually, as JA Surrogacy Canada, don't take on every intended parent as a client. We will actually decline clients. Mm-hmm. And one of those reasons is because there are the red flags where they're not interested in a relationship with their surrogate. They're looking for a transactional relationship. And we're not the agency for that. So we will refer them out to an agency that might be better suited to them, because we want all of our clients to have a great journey, surrogates and intended parents. So relationship is very important to us. We want to make sure that we're giving them the best opportunity to build an organic relationship, right? Yeah. Some other red flags so we have an intake team that deals with the intended parent intakes. They offer them consultation calls to review all the things. One of the biggest challenges we face, of course, is understanding Canadian law, understanding the Health Canada guidelines. Some of the red flags that we feel very strongly about are intended parents that want to do more than a single embryo transfer. Yeah. That's a big thing for us. We don't want to guide any of our candidates to do more than a single embryo transfer unless it's absolutely doctor's recommendation. So understanding how the process works and understanding how much time it takes, and understanding that we don't dictate a surrogate to work with a client. The surrogate gets to choose the client that she would like to be introduced to. So all of those little things become big discussions in the consultation. And if the client continues to either not understand those things or not really kind of be on board with those things, then we will refer them out to another agency.
Okay, noted. We're going to come back to insurance because you and I had a brief email about that and the changes that we've seen in the landscape with the cost of insurance. So we're going to come back to that because that's a point to discuss as a panel, I think. And let's cover off costs in that section as well. So we won't do that just now. But big piece of advice that you would give intended parents? What's that nugget that we need to make sure people leave with today from you?
Sure. We will always advise an intended parent, a new intended parent client, to be prepared to spend upwards of $130,000. And that is an all-inclusive amount. That is your clinical fees, your legal fees, your surrogate reimbursement, your agency fees, your parentage legal fees, and your surrogate's travel back and forth to the clinic for screening and transfer. And sometimes they come in much less than that. Sometimes they come in, 60, 70,000, but more often than not, they're up around 100 to 120,000.
Canadian.
Canadian, yeah.
Okay. Okay, and budget is often the second question that people want to talk about as well.
Yeah, it's a big question for sure, and it's a big undertaking to take on a surrogacy journey. It's a lot of money. It's not something you can just easily walk into if you're not prepared. So we do our best to try to prepare our clients as well on their intake calls to prepare for surrogates that will have varying reimbursement amounts between 20 to 40,000, really depending on their location, what they do for a living, potential bed rest costs if they're off work for any length of time, those sorts of things. How far away are they from the clinic? How often do they have to go to the clinic? All those things need to be factored in. And of course, there's no guarantee where your surrogate may come from, what province they might be in, but it's highly likely that their clinic is in Ontario. So, we deal with Dr. Victory's clinic and Create Fertility and Inova and ReproMed and all those big players in Toronto. So it's highly likely that you're going to have high travel costs as well. So that's also factored in there.
Yeah, good to understand. Okay, thank you. We'll come back. Dr. Victory, you're up next. Tell us. Let's see. Even the shot with the cars in the picture. A nice image I found of you on online. Talk to us about the history then of the clinic, please, if you don't mind, and let's talk about a bit more information about why people turn to surrogacy and what makes your operation so wonderful.
So the clinic has been here for about, this particular clinic for about 3 years. We were in existence for about 12 years before that as well. I really kind of wanted my own program because I felt like what we were seeing using other labs was not exactly the model I wanted. I wanted something that was very patient-centric and very much focused on making sure that we were achieving the best overall outcome we could. So a lot of communication, a lot of education, and then making sure the success rates were top-notch. And what we were seeing was other clinics that had become so large that people were becoming a little bit more like a number, and B, the success rates were being compromised because they were so busy they couldn't actually do the work that was needed to optimize embryo outcomes. And so I kind of wanted to take a step back and say, what can we do to sort of optimize each step of that process so that patients are going to get what they want out of the journey? So we started our own clinic. I basically, put in the best of everything humanly possible. And we've got great people here. We've got an amazing lab director. We put in the best technology possible. And then I spend what my wife describes as a ridiculous amount of time doing research and reading to make sure that we can really prepare and present patients with the best options available for them to achieve that high level of success that we're really expecting. So a lot of places are comfortable if their frozen embryo transfer success rates are around 50%. We're really aiming for something much, much higher, up into the 70s and 80s per embryo transfer. And I'm super happy to hear Michelle mention that, the Suros are really aiming and the agencies are aiming for one embryo at a time. That's really important to us to optimize safety and outcomes. So that's the success we're getting with just one embryo per transfer. So it's been really a wonderful experience here because we're getting out of it what we tried to build it into. So it's been very rewarding for us and for our team and for the patients that have used this.
Thank you. And for the benefit of those that are viewing now and on replay, where your base? You want multiple sites, one location, satellites? Tell us about where you're based.
Yeah, so our lab is in Windsor, Ontario, which is a little bit west of Toronto and very close to Detroit. So clients can either come into Toronto and then fly or drive or train to us, or they can fly to Detroit and we're just 20 minutes from the border if they're going to the US, which is often cheaper. So that's our main location. That's where the lab is. We do have relationships with 2 IVF labs in Toronto. I don't find that their success rates are quite what we're getting here, so it's kind of hard to justify using them, but they are available for the clients or the surrogates or egg donors that exclusively want to be in the Toronto area. And then we do have multiple satellites. So we are currently, we have 3 labs. So this lab and then 2 other satellites. And then there are 2 more opening in the next 6 months. So VRC keeps expanding and I keep trying to control all of it as we go. Yeah.
Amazing.
Yeah.
Okay, so let's look at, as we looked at timeframes from an agency point of view, one of the things that we have seen here as a COVID effect has been the availability to get a clinic appointment in the UK. It still stands at around about 8 weeks. And there's still some clinics are flat out with still backlogs. How is it there? What can people expect to typically get access into your diary and an appointment with you?
Sure. So just to get an appointment, maximum would be about 2 weeks. Usually within a week, I'm seeing most of our patients. I'll often work through the weekends. And so we spend about 45 minutes to an hour on a Zoom call. And I kind of go through a very detailed history with the patient or patients. We'll go through everything about them, about their expectations, about their journey. And then I kind of spend quite a bit of time educating them about the process. So we talk about I always say there's 3 steps. So we talk about the 3 steps in the process, which is the testing for the intended parents. If they need an egg donor, the process of selecting and then testing an egg donor. And then we talk about the surrogacy journey component as well. So those are really the 3 steps. And we go through the timelines of that as well. But usually it only takes about a week or 2 to sit down with me. I do spend at least an hour with my clients. I make sure all of their questions are answered. So it's a really friendly, kind of open discussion. We get to know each other. I often ask my clients about their personal history in terms of how did they meet, how long have they been together. I really want to develop a bond with my patients so that we understand them, not just as clients, but really as people. And so that's really important to us as well. I think Michelle kind of echoed that in saying she really wants to work with people who are a good fit. And for us, it's very much the same. We want to work with clients who are very much in this to help create, warm, loving families. When it's a pure transaction, that really creates a lot of concerns for us as well. And so we're really not looking for those pure transactional candidates. We're really working with people that want this to be an amazing experience, an amazing journey, and want to be respectful of every person that's involved in the process from A to Z.
Absolutely. And touching then on some of the reasons why people turn to surrogacy then. So if anyone is watching this now or later, and if it's a heterosexual person or a couple, obviously there's usually an infertility journey. And obviously if it's a same-sex couple, then there's more obvious reasons why they need third-party reproduction. But talk to us about some of the conditions that people often have when they're turning to you for treatment for surrogacy.
Sure. So there's probably several different categories. So within the heterosexual community, you're going to have women that are unable to conceive, either because they've tried and they've failed, or because of an absence of the parts necessary, whether their ovaries are missing or their uterus is missing. And that could be because of surgical, reasons that have happened before, or some women are just born without a uterus.
Mm-hmm.
So those are frequently some of the things that we see. And then we also see women frequently who have had medical complications. And that doesn't necessarily mean, sort of a heart attack or a stroke or something. It could be a psychological problem. It could be a pregnancy-related problem. It could be something unrelated to pregnancy, but that can be made worse in pregnancy. And it just makes it unsafe for them to continue with that journey. So as a result, they're looking to have somebody else carry out. As a good example, I have a physician in Canada in another province who reached out to me because she had very significant bowel surgery in the past. And essentially the doctor said, if you get pregnant and you need a cesarean section, there is no safe way to do it because you've had so many surgeries, you will for sure get injured. So, just something completely unrelated to pregnancy, but that can have, complications that could arise in pregnancy, which now make it unsafe for her to continue. From the homosexual side, obviously, if it's a same-sex male couple, they are lacking a uterus, and so they need the services of a surrogate in order to facilitate building their family. So, that one's a lot more straightforward. But from the heterosexual side, it can be complicated and sort of breaks down into, hey, I tried before and it didn't work, or I have a reason why I can't continue.
Yeah, of course, and we see. We see a variety of people in a varied emotional state as well, depending on what point they join needing surrogacy.
Sure.
And you've mentioned as well with yourself, when you do see when those red flags are there for you, and that can sometimes be around that transactional relationship or that lack of connection to one another. Is there anything else that you often spot when you're assessing a patient for treatment and you maybe think surrogacy isn't right for them? Or is there anything generally do you make that type? I'm curious to see how involved the physician and the doctor will get with accepting a patient or not.
So I'm probably a little unusual in the sense that I'm very heavily involved. So I take each case on a case-by-case basis, and I'll frequently, especially with, for example, heterosexual couples from Europe, I'll find that in many instances, they get very sort of cookie-cutter approaches to their fertility care. And if it doesn't work with exactly what those centers have offered, then they kind of say, we won't do anything else. And so there are circumstances where I think I can actually help couples conceive on their own without necessarily having to use a surrogate. So I'll always review all of their options. And certainly in some circumstances, it's better to use a surrogate. It's safer, it's going to give you a higher success rate. And in other circumstances, there may be an opportunity to do both. And in some circumstances, we can just go back to the intended parent and say, hey, have you tried this? Would you consider that, to try and give them the best opportunity using, their own uterus that is possible. In terms of red flags, I mean, the big ones obviously are things like smoking, drinking, drug use. Clearly, if that's going on, that's a major issue, especially if it's in the male where we're going to be using his sperm. It has a very negative impact. All three of those drastically increase the risks of miscarriage. So regardless of whether it's using the partner as the carrier or it's using a surrogate, the last thing we want is to help facilitate getting people pregnant and then have anyone, and in particular a surrogate who's so emotionally vested in the journey, then have to undergo a miscarriage for something that realistically was avoidable. So we really want to spend a lot of time optimizing everybody's health. We spend a lot of time making sure the intended parents are in good health. They're providing us with the very best sperm possible. If there's an egg donor involved, same thing with the egg donor. We are very, very careful to make sure that our egg donors are exceptional. And then we do the same thing with our surrogates. So you work with great companies like JA, where they're pre-screening their surrogates and making sure that they're providing you with individuals that are healthy and fit and rational and able to kind of follow all the instructions and are again vested in this to get the best outcome possible for everybody involved.
Perfect. And we touched on it earlier, and this, I know we've mentioned this with Michelle, but I'd be curious to also understand: are you seeing impact of what's happened in Ukraine, which has been the 4th biggest destination for British people to go to for surrogacy based on parental order applications. And have you seen Canada pick up some of those intended parents that would have gone that route? Have you noticed that spike?
Yeah, for sure. So even before the war broke out, and my heart goes out to everyone involved there, our prayers are clearly with them. We did start seeing a spike, in large part because of problems with follow through in places like Cyprus, in places like Albania, in the Czech Republic, and in the Ukraine as well. So I know several cases where they paid for services and just never got them. They paid a surrogate $6,000 and the surrogate disappeared. So I think that reputation is slowly kind of evolving out of some of the destination programs. And so, when you're coming to Canada, I think what many Europeans like is that we are kind of the most European, non-European country around. So they're getting very similar healthcare models, the altruistic system. We are trained to a very high degree here. I know, for example, one clinic I had to look into overseas, I'll obviously keep nameless, but in a very popular kind of destination fertility center, the gentleman, which had called himself a doctor on the website, actually had no medical degree or PhD for that matter. So I'm not quite sure what they were a doctor of. And so, that kind of thing you're going to avoid here because you're going to get licensed staff, you're going to get licensed medical staff. We have to be accredited by Health Canada. The College of Physicians and Surgeons of Ontario and the Royal College of Canada has to license us. So you're getting expertise, you're getting quality, and you're getting security and safety, knowing everybody involved is held to a very, very high standard. And that's true medically, but that's also true financially as well. Like you know that if you're investing into this process with us, that there's someone that's there to answer the finances at the end of the day. Your money's never going to disappear when you're coming to Canada.
Mm-hmm. Good point. Thank you. Before we come to Natalie, one of the big changes that we obviously had here with obviously shipping gametes, and especially during the pandemic, it was incredibly popular. And has remained really popular, actually, with people creating embryos here and then shipping, whether that's eggs and sperm or embryos. Gametes are definitely more movable now, and intended parents are more aware of that. Are you seeing that from other European countries? Are you seeing that that's a trend that stayed and is here to stay? What's your intake on that, your take on that?
Yeah, so we definitely saw a huge spike with the pandemic. There's no question. I think it partly depends on what you very clearly defined as gametes versus embryos. So if someone's already created embryos, clearly they're going to ship us the embryos because they're not going to just abandon those and come here to do another journey. And that makes a lot of sense. And thankfully, Health Canada doesn't actually regulate embryos. We just need to have appropriate documentation of testing that was done before. And then, doing the surrogacy journey is actually quite simple. For gametes, we do have a shipping process. In fact, we are just putting up a new sperm shipping video on our YouTube channel today to go through that whole process for intended parents. But the truth is, we much prefer that the patients come here, because when you're freezing sperm on your own, if you get everything here and it's perfect, that's great. But if there's any degree of compromise to the quality of the sperm or the process that was used, we don't have any recourse for correcting that. So when the intended parents come here, if we don't get a great sample, we can say, come back tomorrow or come back in 2 days. And then get more sperm and hopefully get better samples. When it's shipped, it's a one and done, and you're literally putting all your sperm in one basket. So we prefer that the patients come here, but obviously you know, depending on where they're coming from, there are instances where it can be difficult. We find that with our staff here who facilitate those journeys, the physical, actual, you know, journey of coming here for our patients, it makes it really enjoyable. They turn it into a mini holiday. They show up and we get much better results. And there is some evidence to suggest that the sperm you get from being here and coming and delivering it in person is actually going to yield a better outcome ultimately. So that's really important as well, because when you are investing $100,000 into this or $120,000 into this, we very much want it to work on first try. I always tell everybody, I'm not interested in return business. I want it to work on the first try so that everybody is walking away saying, wow, that was, you know, quick, easy, efficient, and we had a great experience. So, you know, every single thing we can do to maximize, we're going to try and do.
Perfect. Okay, I'm going to come back to best piece of advice because there's something else I'm going to talk on in a minute. I'm going to bring on Natalie from Burgess Mee. Natalie, just tell us all about your experience with intended parents and surrogacy, please.
Yeah, so I've been doing surrogate. So I'm a family lawyer, doing general family law, but also do surrogacy and fertility law. I help intended parents who are going through a surrogacy journey, both domestic and internationally, dealing with lots of different jurisdictions, Canada being one of them. So I help them deal with their parental order process, but oftentimes I get contacted by clients who don't yet know what jurisdiction they want to choose. So they are very much at the very beginning of their journey. So they are doing very well in getting legal advice straight off the bat, but also are looking for their various jurisdictions. And that's when I can point them into the jurisdictions that I've had experience in, or point them away from jurisdictions that won't be suitable for them. For example, LGBT community wouldn't have been able to use Ukraine. So I have that I have that involvement at the very beginning, and then as lawyers we kind of drop off, apart from we like to keep in touch with our counterparts in the other jurisdiction, and then we come back into it to help our clients when they're back in the country with their baby, because now they have to apply for their parental order. Just because they have a birth certificate in Canada with their names on it, that does not mean that they are legal parents in this jurisdiction, in England and Wales, if this is where they want to bring up their baby. So it is very important that intended parents are aware that they need to have that order made by the UK courts so that they have their legal parenthood.
Yeah, and it's surprising still how many intended parents that arrive quite new and don't realize that that is something that they still need to do from a parental order process. What are you seeing? We've spoke about trends, everybody else. What are you seeing now in terms of your client base? Are you seeing more British people want to go back international again? Because we had a slower period of 12, 18 months in the UK where that destination, or certainly going to North America, wasn't on the agenda as much. Was that your trend that you were seeing through Burgess Mee and your work?
Yeah, definitely. So obviously not being able to travel, it just put a stop on all of it. But what it did allow people to do is do their research and spend that time, because the desire to want to create their family hadn't gone. And of course, I think during the pandemic is when the HFEA clarified the rules so you could ship gametes. So that, kickstarted everything again. And I think people are looking at other jurisdictions and are able to now travel. But you're right about Ukraine. That was the European destination of choice for people who could not afford North America. And then that is now, you really shouldn't be going to Ukraine right now because it's very, very unstable. But there are other countries like, as you say, Georgia and Mexico, I think, so emerging destinations. But a lot of British IPs, I think, are attracted to Canada because of it's cheaper than the US, but you're getting a similar service, similar language. It's speaking English, and it's an altruistic system like we have here, and it's just very, very similar, with the NHS type thing as well. So so Canada really sits well, I think, with British IPs who have enough money to go abroad, but and perhaps the US, because it is more expensive, isn't it, the US? But Canada is a very good option.
Mm-hmm. And we spoke about engaging with a lawyer early on, really, to understand their parental responsibility and their legal parentage and their rights. How often do people not take that type of advice, and how often do you get the lastminute.com type call? My baby's been born, I need a lawyer. Does it happen often?
Well, I've had people at the moment. I said, well, you're having a baby through surrogacy. That's amazing. Do you know about the parental order process? And they're like, oh, I kind of know about it, but really hadn't drilled down into the detail about it. And Mike, you'll know about the case that Jay did, X and Y, the adults. So this is a British couple that had a baby born through Californian surrogacy and didn't know they had to get a parental order, and their child is now an adult. So they had to quickly go to court and get a parental order, and it was reported because that had never happened. We'd never done a parental order for an adult child before. So it's happening even now.
Yeah. Crazy. Quickly then, in terms of parental orders from magistrates and high court, what tends to be the difference, and why would people go one over the other?
Well, if you're going through a Canadian journey, you wouldn't go to a magistrate. You would be straight into the High Court because it's international. Mm-hmm. So, and that's a really good thing, because we have very, very, very good judges who deal with surrogacy and the fertility side of things all the time. And I very much like going through the High Court because it's just a slicker process. Magistrates, they are not legally qualified. They are lay people, but it's just the way that we do things. Not family court level. It's one down. As lawyers, you kind of tend to want to avoid the magistrates, but if you are a domestic surrogacy journey, that's where you'll have your parental order process. So
cool, thank you. Time frames we've kind of covered, but your best piece of advice, I'm guessing it's engage early. I might be wrong.
I know it sounds like a broken record, but definitely, because what you want to do is make sure that you have that bespoke advice. So you've made sure that you're going to be eligible. Now, that's not to say that things can change. So there are cases that we deal with where perhaps an IP has died or they split up. So that is life happening to you during your journey. And that's what I also want to get across to intended parents, is that this is not a straight line, that there can be many bumps in the road and you have to be patient. But getting your advice early just stands you in the best possible position to start this. Knowledge is power. And then also you have your lawyer then on board in case anything else goes wrong, in case you have any more questions. And having a British lawyer on board, they can also then speak with the Canadian lawyer, make sure that all the paperwork is as we like it, makes the process much smoother on this side. And and we can all help each other, and it works as a really good team.
Thank you. I'm conscious of time and everyone's availability, so I'm just going to go into the next slide quickly, because this one's quite an important one. As much as the title, the top, is freaking me out. If we look at some of the costs that we wanted to talk about, and these are numbers that we've already confirmed, I'm glad to hear on here. But in terms of what people's budgets need to look like for a Canadian journey, if we look at the bold number, that's the number that we're drilling into, and that's between 100,000 and 135,000 Canadian. And one of the things that we really wanted to talk about on this particular call was some of the increases to a journey, and that's really at the moment around newborn insurance. And when we ran a Canadian webinar 8 months ago, the cost was half of how it sits now, and it sits at currently minimum 10,000 USD, but could be 15, 16,000 based on early start of policy, pre-embryo transfer potentially. Michelle, what's been this driver where insurance is just getting so expensive?
So we used to consistently refer to Allianz. They were the provider of choice, the broker of choice for newborn insurance policies. In the last 18 months, they have changed their policies drastically for newborn coverage, and they don't offer the expansive coverage that a potential NICU could cost. New policies, I do believe, through Allianz now have a $30,000 maximum payout when you add the new baby to the policy. So that is concerning for intended parents coming from an international place that may have a very early delivery, might have early twins, or might have a sick baby that needs some NICU time. That does, those NICU costs are, they start at $6,000 to $8,000 a day, depending on what's going on, and they can go upwards of that. So there is a new broker on the market, Baby Shield, they are called, and they are designed specifically for surrogacy. Their policies run about $900 US a month. So and they have to be placed 1 month prior to your transfer. So they have to be in effect 30 days prior to your transfer in order for you to add the baby upon birth. And their policies are cancelable once the baby's born. So as an intended parent, you can choose to cancel it in the 10th month when baby's born, and perhaps add the baby to your own personal policy. Or perhaps you might need that insurance for an additional few months, and they do cover that for up to 6 months after the baby's born. But it is an expensive policy, but it is very easy to get. The procedure to deal with Baby Shield is fairly straightforward. And then if Baby Shield isn't a great option because it is more on the expensive side, there are other options that we'll refer our clients to Art Risk in the US. There's Great Morning. I don't think the Lloyd's has a policy anymore. Art Risk has on their website, they have a list of options for Canadian and US intended parents to get insurance for their newborns. But one of those policies is through BUPA, BUPA, and they do require that the policy is placed 5 to 6 months prior to transfer. So sometimes, that leads into a bit of a longer period of time. So it's up to the IPs to make sure that they're covered for potential NICU costs. Of course, nobody ever wants to have a baby in the NICU, and those costs are exponential. They can increase really quickly. So we want to make sure that our intended parents are aware, if they don't have insurance, what they're looking at, potentially paying for hospital costs, because that baby is a surrogate baby and isn't covered under the provincial health plan of the surrogate. So that's also a very important piece to educate the intended parents on.
Wow. I feel insurance is it's one of those additional elements that we don't have for domestic surrogacy here like that. It's quite straightforward. But great to hear the knowledge that you have in terms of that complex piece. So that's clearly reassuring for anyone that is opting to work with JA.
Well, we have a great relationship with Art Risk as well, and they have done a great job in keeping us informed, and they do a great job with our clients. And so it's great that I can have my team speak to this as well. Each intended parent support worker is able to speak to this and introduce their clients to the different pieces of the journey with insurance.
Great. Yeah, Art Risk have been doing some great work for our intended parents too. I second that. One of the costs that's slightly cut with where the screen is, which is a crucial piece because it was an area that Natalie represents, returning intended parental order costs for a UK surrogacy lawyer. In addition to, your journey as mentioned above, you need to be budgeting anything between 10 and 16, 17,000 pounds for that element of that parental order. That line is just slightly missing, so I just wanted to add that and make sure that everyone knew. In terms of then next stages, then I just wanted to round up. We're coming close to finishing now. I just wanted to get one final closing word from each of you, and a message to those people that are either viewing now or later and are considering weighing up the multiple options of choosing a destination, and Canada is in that mix. Dr. Victory, why Canada?
I think that you're going to get a lot of safety, security, and really avant-garde technology and success by coming to Canada without the US price. And so for me, we're actually expanding to other parts of the world as well, but I'm never going to be able to achieve elsewhere what I can achieve here. because here we have the quality that we want, we have the equipment that we want, we have the people that we want, the training and so on, in an environment that allows for this to occur without you having to, salvage one of your kidneys to sell on the black market. So it's a very hospitable, high quality environment where we take very, very good care of people. And when I say we, I mean both the fertility centers, the surrogacy agencies, the egg donor agencies, the fertility lawyers. The team here in Canada is outstanding. It really cannot be beaten, in my opinion.
I agree. Thank you. And Michelle, from you, one of the options to choose an agency in Canada, how, like the UK, it seems to be growing on a monthly basis. What is it that makes JA stand out?
Honestly, speaking strictly from the way our CEO built the company, it was based on support system and based on individualized human experience. Her and I actually had done other journeys through other agencies, and our intended parents and surrogates alike didn't get the service or support or protection that they needed. So for us, it's really about being transparent with our clients and helping them build a relationship organically with their surrogate, but also building a rapport and a relationship organically with your surrogacy agency. It's very important to research your agency. Talk to all the agencies. There's small ones, there's large ones. We all have different aspects of things that we are amazing with, and we are always open to constructive feedback here at JA. So our clients actually have a little button on each one of their emails where they can send anonymous feedback, and it's been a fantastic tool to help us grow and achieve more client care. But for JA, it's about client care and relationship.
Great. And how can people find JA? Can you give us some details?
Sure. You can always look us up online. We have a website, jasurrogacy.com. We have a Facebook page, just JA Surrogacy Canada. You can find us. You can, in the review groups, if you are in Facebook, you can go into the independent surrogacy groups. And if you ask about agencies, I'm very pleased to say that JA does get quite a few recommendations. Yes. And our clients, I'm going to hazard a very big guess, because all the referrals come through my inbox. You'll be introduced to me before you're introduced to the intake team, and I am responsible to respond to all the client inquiries. But I'm going to say that 98% of our client referrals are word of mouth referrals from other intended parents, from other industry professionals. The industry professionals that refer to us do refer to us based on the fact that they know that we will do our best to take care of their clients.
Great. Super. And finally, Natalie, from yourself then, in terms of making sure that an intended parent chooses their lawyer wisely, what are the things they should look for? And obviously you're fabulous, but apart from that, what else should they be looking for?
So a family lawyer is a very personal relationship. So definitely, do your research, find someone that connects with you. But also, if you're picking various different jurisdictions and you're choosing Canada, then we work very well with our Canadian counterparts. So you're in very safe hands with the two jurisdictions.
Amazing. Thank you, everybody. That concludes tonight's stream on surrogacy in Canada. Again, I'm going to put all the comments, everyone's website, everyone's contact details. I've really appreciated and super grateful of everyone's time this afternoon and this evening. So thank you very much for joining, and we'll see you all soon. Thank you very much. Take care.
Thanks so much.
Bye-bye.
Bye.